All right, folks, in the wake of Hurricane Melissa and amid the peak of the flu season, there have been growing concerns about hospital capacity and reports of overcrowding at some facilities. To bring some clarity and context to the situation, we're joined by the Honourable Minister of Health and Wellness, Dr. Christopher Tufton. Good morning, sir.
Morning.
Morning, sir. Morning.
Belated happy birthday,
yes.
sir.
Thank you very much.
Always great to see you. Yeah, we've been hearing about, especially in Cornwall. Let's go to Cornwall first. We had the head of the Nurses Association, and she said when she went there, should have been 40, there were 112.
Yeah.
Can you explain why and what's going on right now?
So I fully identify with the challenges in the system now. Mm-hmm. So it's not a rebuttal to her concerns, but the context is important. So we have never had a Category 5 hurricane on our shores. And the devastation that was brought to the communities, particularly of those 5 parishes, has created significant disruption to the health services. Indeed, we lost more than 50% of our bed capacity in those parishes, Cornwall included. So essentially what has happened is that there are patients who need inpatient care, but because the contractors are repairing those wards, they have to be in a holding area, hence the overcrowding in A&E. It's difficult because the capacity is not, A&E is not for inpatient care, but it's an extraordinary circumstance. Now, we are now working, this week we're bringing back on stream maybe another 100 beds for Cornwall Regional, and over the next 2 weeks or so we'll get back up to full capacity. The other challenge that we face was the post-hurricane impact on patients who have either not continued their regime to take their medication. So people with hypertension, with diabetes, obviously they are disturbed by the storm. They have lost, distractions around losing their personal possessions, not going to their health centers. So we had a spike in cases of persons who were out of control in terms of their condition. They end up at A&E, that's the first point of stop. So it's the approach has to be to repair, and it does take some time, but also to encourage Jamaicans to go back to their health centers and get back in their routine. Remember now, lifestyle disease is the #1 challenge that we face. Yeah. And if you don't treat it or control it, you end up in an emergency.
Yeah. Just before Debbie, sir, because I know some of the wards were damaged, I say that to say, where are you going to put the 100 beds? Or those wards are okay now?
Yeah, so immediately after the hurricane, we dispatched contractors to initially save lives. So where we needed to do some quick makeshift repairs, including the A&E at Cornwall, repair some roofs quickly. We did that. Then they went now to the wards, and they are now actively fixing up those wards for re-engagement.
Yeah. Minister, let's talk about the solution for the shortages of nurses, because we've been having conversations. We had a conversation last week with the head of the Nurses Association, but also the week before that, we had a conversation as well with another nurse who migrated. So this concern about the shortages of nurses in our health facilities and our hospitals has always been something that we've dealt with, yes.
So the couple of challenges, if you have to start with the sick profile of the population. There is a lot more demand on the system because of early onset of illness, premature mortality. So a population that really, because of lifestyle, we have to treat, and the demand has grown. The training of healthcare workers has not kept pace with the demand for a number of reasons: clinical rotation, space, and faculty members, and the mass recruitment of our healthcare workers, particularly nurses, to North America, Canada, and the UK. The traffic has gone one way, and they take out more than we are able to replace. So you end up with a shortage. Now, we have been doing some work to expand training, subject to the limitations of clinical rotation space, and also to make working conditions, salaries through compensation review, more attractive to try to retain. We are also looking at cross-border collaboration. You may have seen where the Ghanaian foreign minister was here a few days ago. One of the agreements that we signed was to have Ghanaian nurses and specialist nurses come to Jamaica. Last year I went to the Philippines, to India. Now, we have these nationals here, but just in a few numbers. We'd ideally prefer locals, but where we have those gaps, we're going to have to do more to fill them. And Cubans have always been here, as you know, in the system.
Let's go back to the hospital, sir. Black River, that was totally damaged.
So Black River was damaged. All 5 hospitals in those parishes were badly damaged. Black River, the most severe. The contractors are there restoring. Within 5 days of the hurricane, we had NGO out of the US, Samaritan Purse, putting in the field hospital. They have left, but the field hospital remains. We relocated it from the Black River High School to the Black River Hospital. That hospital carries about 45 beds, and it's being used, while the main ward area and the operating theater is now being repaired. The challenge with Mandeville, which you probably would have heard of, is that most people from St. Elizabeth are ending up at Mandeville Hospital. So the system is connected, and hence the overcrowding, part of the reason for the overcrowding in Mandeville, because Black River is now 30% of what it is. A 150-bed facility. It only has 40 beds.
Wow. Yeah. Medical centers, sir. Let's talk about those.
Right. So we had about 105 health centers that were impacted by this storm. Again, the response to the crisis in the immediate aftermath is to save lives. So we focused on quick responses to get these facilities back up. And we are there now, which is what people going to those facilities are about 60 to 80% of what used to be before the hurricane. Hence why we're seeing some of them ending up in A&E. So that's an important thing. But what we're doing now is doing a more structured assessment of the buildings that were impacted. So the engineers are now assessing to determine whether or not the walls are compromised. And the intention over the next month or so is to do a more long-term repair of those facilities, which may mean abandoning some and rebuilding others. That's part of the whole NARA that the Prime Minister has announced in terms of more sustainable build back. But they are functional, the team are out there, and we do encourage Jamaicans to go back to your health centers, because that's really where we start with the support.
Minister, we keep hearing normalcy, normality. All things being equal, which you don't know, because sometimes we get this holy parade and stuff. All things being equal, when do you think overall in the health sector we will be back up to what can be considered normal?
Having been there for so long, I am prepared to say there's a crisis around every corner. So it's always a work in progress. But as it relates to the hurricane and getting as close to normalcy as possible, I think by March of this year, we would have restored bed space. So in another 6 weeks or so, end of April, mid-March, which would then allow the inpatient support. Beyond that is a more medium to longer term plan. We're going to look at Black River, Falmouth and Noel Homes in Hanover to determine whether we relocate the hospital altogether. Now, if you're going to build a new hospital, clearly it's going to take a few years. But what we want to do is to get back to where we were, so that we can carry out patient care in a more fulsome way.
The good news about speaking with the president of the Nurses Association, when I asked her why they're leaving, she said money is not the problem anymore.
She said she said that.
Yeah, she actually said
and I have said that in the past and been criticized, but I'm sure she's not going to be criticized. The management of the resource is very, very important. But again, it's such an unpredictable portfolio in terms of things just happening, like a natural disaster, that you kind of have to be always on alert and always be willing to respond to these issues, despite the criticisms.
Yeah, absolutely.
Thanks for coming, sir.
Thank you very much.
And all the very best to you and yours for 2026 and beyond, sir.
Thank you, and same to you.
All right, that was our Minister of Health and Wellness, Dr. the Honourable Christopher Tufton. Coming up, we get into He Said, She Said after the break. Yeah.
He said, not who you said.